Individualized education curriculum, a document that describes a student's specialized learning opportunities. What does this mean to you?
Okay, class, today we're going to be talking about grammar, so can everybody pull out their notebooks? As we know, a noun is a person, place, or a thing. Can anybody tell me what a verb is?
On the left, they gave each woman in the band a left cowrie shells for a short necklace, one large brown shell, and 20 large gray ones. The shell came from I don't really think that's appropriate for this class.
Oh, hey, did you get the assignment done for next class?
Assignment? What are you? Hey, do you not hear me?
Can you not hear me? People with hearing impairments either have little or no ability to hear. It is caused by several factors and is often detected at a very young age. Hearing impairments are often due to genetic causes such as the mother taking medication while pregnant. Secondly, it can come about due to an illness or infection such as jaundice, meningitis, high fever, or consistent ear infections. Finally, it can be due to physical trauma such as injury on the ear or physical abnormalities to any part of the ear. Today we're going to talk about the different developmental effects that one with a hearing impairment may go through. We're going to cover the cognitive development, the speech and language development, and the social and emotional development of this impairment. Generally, people with a hearing impairment develop slower than others. Physically, they may tend to be delayed in walking or sitting up on their own. In addition, they tend to have difficulties balancing. In terms of the cognitive development of this impairment, people with this impairment may have difficulty expressing their ideas to others. However, they are academically ready and have a fine grasp on visual, spatial, and fine motor skills. The second way in which the impairment can develop is through speech and language. Generally, they tend to acquire exceptional nonverbal skills. However, they tend to develop slower. For example, they may say their first words later on in their years, as well as they tend to produce shorter sentences with simpler meanings. In addition, they may have difficulty understanding words with multiple meanings. They also prefer more concrete words such as cat, desk, or mat, as opposed to abstract words such as jealous, after, and hope. Finally, people with the hearing impairment generally mumble or speak at the higher pitch and can't really hear themselves when speaking. Lastly, we're going to talk about the social and emotional development that they go through. People with hearing loss have good social skills. They love interacting with other people and being around other people. However, they often act without thinking and interrupt people when they're talking. They have difficulty paying attention and are rather hyper. In terms of following routines, they don't necessarily need one, although they do need warning in between switching tasks. Lastly, they have trouble following social cues and respecting other people's personal boundaries. After realizing a child may have a hearing impairment, further testing is done to assess the child.
Assessing a child that is born with a hearing disorder happens in the hospital after birth, where they do a hearing screening. Assessing a child who may have a hearing disorder usually starts at an early age where parents detect a stunt in language development. There are tests to assess if a child has a hearing disorder and to what degree they have one. Children who are too young to respond can go through 3 types of tests: autoacoustic emissions, auditory brainstem response, and behavioral observation audiometry. Autoacoustic emissions is when a tiny probe is placed inside the ear canal. This tiny probe will release sounds and detect if there are responses to the sound. Auditory brainstem response is when electrodes are placed on the head to record brain activity when sounds are heard. Behavioral observation audiometry is when an audiologist makes a sound while the child cannot see and the second audiologist watches for any changes in child's response. Children who are old enough to respond can go through 2 types of tests: visual reinforcement audiometry and play audiometry. Visual reinforcement audiometry is when a child is presented with sounds by a tester and is watched to see if the child can locate the sound. Play audiometry is when a child is presented with sound and he or she must indicate the source of the sound with an activity. The results of these tests are shown on a graph that is called an audiogram. On the audiogram, the vertical lines represent pitch or frequency, and the horizontal lines represent loudness or intensity. After figuring out if the child has a hearing impairment, an audiologist and other professionals decide what to do. Children who are born with a hearing impairment usually get diagnosed at birth when a hearing screening is done. Children can be tested to identify if they have a hearing impairment by doing a number of hearing tests such as audioacoustic emissions, auditory brainstem response, behavioral observation audiometry, visual reinforcement audiometry, and play audiometry. The data collected from the tests are then put into an audiogram that can be further assessed by individuals to accommodate the child.
There are various types of communication used by people with hearing loss, and these can be incorporated or accommodated to students in school settings as well. IEPs, certain programs, specific educational assistance, as well as certain separate schools may use one or more of these methods. American Sign Language, or ASL, is a natural language used by members of the deaf community in North America. It's a rule-governed language that develops naturally over time with signs and symbols that are organized and used systematically. This is the reason that ASL exhibits all features of any language. The numbers of sentences that can be created are infinite, and new messages can be combined to make new signs and sentences. Langue des signes québécois is the Quebec Sign Language used by deaf people in Quebec as well as other centers in Canada, and it's relatively close to both American and French Sign Language. Mutually coded English systems refer to a number of sign language systems that use grammar and sentence structures of English. A couple examples are contact sign and signed English. If I were to use ASL, I would sign I'm hearing. But if I were to use signed English, I might sign I can hear. See the difference? An auditory oral approach is based on the principle that many deaf and hard of hearing children can be taught to listen and speak with early intervention and consistent training to develop their hearing potential. The focus of this educational approach is to use auditory channel to acquire speech and oral language. Similar to the auditory oral approach, where the emphasis is on maximizing a child's residual hearing and his or her ability to use it, auditory verbal approach focuses on the use of sound as the primary channel for learning and gaining meaning from the environment. This approach requires sessions with an auditory verbal therapist in which parents take full and active part. Cued speech is a visual communication system that uses 8 hand shapes in 4 different placements near the face, in combination with the mouth movements of speech. So the consonant H and its sound uses this hand symbol. The placement of the hand changes based on the vowel that follows the consonant. So, he, he, and ho are shown here. Cued speech makes sounds of spoken language look different from each other. Speech reading, on the other hand, is the ability to gain understanding of speech by watching facial expressions, gestures, contextual cues, body language, as well as lip reading. Of all the types of communication, sign language is the official language of the deaf community and is consequently the type of communication more frequently used in educational settings. Cued speech and speech reading are supplemental to one another and can be seen more socially and practically applied than educationally implemented. It is important to point out the significance of assistance and accommodations for the hearing impaired. An audiologist, for example, is a healthcare professional who provides assistance in assessing and treating hearing and balance problems. The audiologist assessment would assist the student in learning to cope with and address these issues. The assistance here can be applied to both social and practical settings as well as educational settings in terms of preparation, conduct, and success. Auditory verbal therapy, or AVT, as I mentioned before, is a parent-centered approach that encourages the use of spoken language to help children to learn to listen and speak. Therapy is an ongoing process toward improvement, and the parent plays a vital role in the progress of his or her child. Auditory verbal therapy will assist in the development and communication both out of and in school. What about assistive technology? A cochlear implant can be considered a kind of assistive technology. It is a surgically implanted electronic device that helps to improve hearing in individuals with severe to profound impairments. The cochlear implant assists children who are impaired by allowing them to process sound and reciprocate verbal information. So it enables some level of hearing, improving school performance and communication clarity. It's definitely assistive in inclusive settings where other children possess their full hearing capacities. A recently introduced technological phenomenon comes from motion savvy, and this was formed by a team out of the Rochester Institute of Technology and initiated the future of sign language interaction with technology through a device called Uni. As the first of its kind, this device translates sign language into audio and spoken word into text. Uni uses advanced gesture recognition technology called leap motion. This allows users to see how their signs appear on camera, which helps to make sure signs are input correctly and that there's no missing information. Assistance within the classroom is incredibly important, especially considering the wide range of exceptionalities that may exist in any given classroom. Particularly inclusive settings, trained assistants are ideal for the success of the student. An itinerant teacher provides appropriate and trained assistance needed for deaf or hard of hearing. An example of specialized equipment within the classroom is an FM system. This is a frequency modulation system that consists of a transmitter microphone and a receiver. The speaker or teacher uses the transmitter mic, and the listener or student uses the receiver. The receiver transmits the sound to the listener's ears or directly to the hearing aid. An FM system is an assistive listening device that improves the signal-to-noise ratio and reduces the effects of poor acoustics.
Accommodations allow children to adapt to educational settings on their own terms. For children who are hearing impaired, there are minor changes that can be made within their particular learning environment. Although accommodations can be subjective to the individual's degree of hearing loss, the accommodations listed below are suggested to ease the stresses experienced by all students with hearing impairments, regardless of the degree of loss. The following are adjustments that can be made to the classroom environment and teaching methods in order for the student to receive and process information communicated by the teacher and to keep pace with their peers. Provide seating at the front of the classroom near to and facing the instructor to ensure that visual cues are optimally received. Face the student when using the board and visual aids, even when wearing a microphone for a student's FM system. Turning your back does not allow for lip reading cues, so speak clearly at a normal rate and speak in a normal tone of voice. Ensure that the lighting is adequate and that the speakers are alerted to potential distractions such as gum chewing and hand placement that may interfere with lip reading. Visual aids should be used whenever possible. Use the board, maps, charts, illustrations, and captioned videos. When showing slides or videos, provide the student with an outline or summary of the materials to be covered in advance. Be careful not to speak over the sound portions, even if the student is using an assistive listening device. Repeat questions from others in the class before answering. Do not exaggerate pronunciation, as this will deter understanding. Keep environmental noise to a minimum. Do not give out procedural information while handing out papers or exams. Make sure that instructions or information are clearly understood by the student after handouts are viewed. Emphasize important information such as assignments or schedule changes by providing written details to students on the board or in handouts. Make sure the student understands the information presented to him or her. Don't accept a nod or smile as an indication of understanding. Ask the student content questions rather than yes or no questions. Include the student in all class experiences such as student conversations and small group activities. Keep in close communication with qualified specialists on the student's team, especially the itinerant teacher for the deaf or hard of hearing. The student may not yet have developed skills to advocate for him or herself in a general education setting. And finally, help the student understand his or her own hearing loss and provide an opportunity for the student to share information with the class about hearing loss and his or her own hearing aids and FM system.
We refer to students who have degrees of hearing loss as hearing impaired. What is interesting is the response that the deaf community has to this definition. The textbook states that members of the deaf community do not view themselves as having a disability. Deaf people do not consider themselves deficient, disabled, or impaired, no matter what degree of hearing loss they may have. Labeling themselves as deaf acknowledges them as a cultural and linguistic minority group. They share a common language and a rich culture and community.